This video's aim is to help if you are suffering with osteoarthritis of the hip joint. Anatomy of the hip joint. Ball and socket joint between the femur and the pelvis. Surrounded by ligaments and muscles. Has a cartilage labrum around the rim to deepen the socket. There is a hyaline cartilage lining the joint. Osteoarthritis is when the cartilage of the joint wears out. Symptoms include pain when weight bearing and walking. Stiffness is common first thing in the morning and after being static for too long. Weakness around the hip and reduced function can occur if the osteoarthritis is worse. On an X-ray, the arthritis is graded in severity as follows. Grade 0 is normal. Grade 1 is possible joint space narrowing and subtle osteophytes, which are bone spikes. Grade 2 is definite joint space narrowing, defined osteophytes, and some degeneration called sclerosis, especially in the acetabular socket region. Grade 3, marked joint space narrowing, small osteophytes, some sclerosis, cyst formation, and deformity of the femoral head and acetabulum. Grade 4, loss of joint space with the above features plus large osteophytes and increased deformity of the femoral head and acetabulum. The most common place to feel pain relating to arthritis of the hip is in the groin area, but it can also cause pain into the lower back, the glutes, and down the leg. Mild to moderate arthritis can be treated conservatively without surgery. Exercises are able to help your symptoms. The flexibility exercises should be pushed into discomfort while performing them, but should generally make you feel better and looser afterwards. The strengthening exercise should be pain-free or should not increase your pain during or after. If you get worsening symptoms or are unsure, then initially reduce the push into the discomfort, and if this isn't enough, then stop altogether and consult your physiotherapist. Flexibility exercises. The first exercise is single knee hugging. Lying on your back, bring one knee up towards your chest, grab your knee and pull it so you feel a stretch. Hold for 20 seconds. Now swap and repeat with the opposite leg. Next, bilateral knee hugging. Lying on your back, bring both of your knees up towards your chest, grab your knees and pull them up so you feel a stretch. Hold for 20 seconds. Next, extensions in lying. Lying on your front in a press-up position. Use your arms to push up so that your lower back arches and your pelvis remains on the ground. Go as far as is comfortable and hold for 20 seconds. The next exercise is hip flexion, adduction, abductions. Lying on your back, bring one knee up towards your chest, grab your knee and pull it up so you feel a stretch. Next, roll your knee from one side to the other. Continue this movement for 20 seconds. Now swap and repeat with the opposite leg. The next exercise is hip external rotation. Lying on your back, bring your knee up towards your right shoulder with your right hand on your knee. Maintaining this position, take hold of your right ankle with your left hand and pull it round towards your head. Hold for 30 seconds, Now swap and repeat with the left leg. The next exercise is hip internal rotation. This one is a less aggressive stretch, but there are also other ways of stretching this movement. Lie face down and bend both of your knees at right angles. Now allow your feet to move apart using gravity to gain a stretch. Hold for 30 seconds. Strengthening exercises. The next exercise is glute strengthening, the Clam. Lying on your side, feet together, knees and hips bent and knees together. Slowly lift your top knee off the bottom one as far as you can, but being careful not to roll the body at all, then lower down. Repeat 15 times or till fatigue, then change and do the other leg. The next exercise is bridging. Lying on your back, put your feet flat on the floor with your knees bent to 90 degrees. Next, lift your bottom off the ground, tilt straight and lower back down. Hold at the top for 5 seconds and repeat 5 times or till fatigue. The next exercise is knee pivots. Lying on your side, feet together, knees and hips bent and knees together, slowly lift your top leg off the bottom one. Now the aim is to keep the knee of your upper leg in the same spot in the air so that you pivot around it. Next, lift your heel up towards the ceiling. Now lower the heel down as far as you can, maintaining the same knee placement in the air and without rolling back with your body. Repeat 15 times or till fatigue on this side, and then swap and repeat for the opposite leg. The next exercise is heel pivots. Lying on your side, feet together, knees and hips bent and knees together, slowly lift your top leg off the bottom one. Now the aim is to keep the heel of your upper leg in the same spot in the air so that you pivot around it. Next, lift your knee up towards the ceiling without rolling back with your body. Now lower the knee down as far as possible, maintaining the same heel placement in the air. Repeat 15 times or till fatigue on this side, then swap and repeat for the opposite leg. All of these exercises need to be done at least 3 times a day, ideally little and often. Remember, osteoarthritis is not a curable condition, but the symptoms can be managed and improved. It takes a few weeks to increase the flexibility and several months to increase strength, so give it time and persevere. Obviously there are many more exercises that you can do, but the ones in this video are a good starting point.